Hello and welcome to IFAH. Could you please introduce yourself and tell us what you do?
Hello, my name is Reginald Mbawuike. The Mobile Health Fellow at Harvard University. Been that for the last 7, 8 years. I 8 years ago built a mobile health app, if not the first, one of the first fully functional mobile telehealth apps that allowed electronic medical records, uh, live voice and video stream, and connectivity to a medical doctor through one mobile phone. So we did this in 2013 and moved on to 2014, becoming the Mobile Health Fellow at Harvard, introducing this to most of the doctors in the medical school and the School of Public Health. And a year later, we got 25 of those doctors to join our team. And we've conducted a couple of clinical trials to test the app in Africa. Due to HIPAA regulations, that was illegal in America at the time. Due to EHR, electronic medical records in general, were not legal to take physically outside of a hospital at the time.
Right.
So we were able to use our connections. I'm first generation African American, and conduct health missions in Africa. Very grateful to all the doctors that joined us and all the nurses that joined us on those trips. And also to the patients who allow us to collect their data, even though we were doing well as well, supplying them with medication and some sick people. Now, post-COVID, we've done a lot of things. I don't want to tell you everything. I'll just let you ask me some questions if you want. We now have the commercially viable product. Thank you to the couple of heads of state, President Remengasa of Palau, and the Minister of Health over there, Dr. Emmace Roberts, to allow us to launch it nationally in their country, so that we could see how it's used for population health, and then obviously then launch it back here in America at a time like this where it's needed. Yes.
Amazing. So, congratulations on winning your award.
Yes.
How do you feel about winning? And also, what are the factors that led you to winning?
Well, it is a great to be acknowledged. We're over there at Harvard wearing our like pearly gates, and everyone behind the scenes knows you. But it's good to be out here and in the home of Elvis, with the rock stars, and seeing that seeing that this now that it's publicly acceptable to use telehealth. We've been promoting that, but we're actually promoting the use of telehealth for patient empowerment. And for us to look at all these other telehealth apps, which is grateful because we're called Give 'em Health. So we want more people to get into this. A lot of people think about being independent is being successful. Actually, no. Being interdependent is being successful. Working with people and having codependencies where you all need each other and you all grow with each other, so we could have hospital after pharmaceutical after pharmaceutical, all coming together like we did in the last year to produce vaccines, to make as many doctors from state to state available for patients. So this being a recognition that such action, that socially responsible action, that deciding to put yourself out there. Yes, you could have a startup, but instead you're doing it in a school for clinical trials to see how far this product could be used to decrease health disparities. And then seeing at this moment where we have such significant health disparities and comorbidities, it's just it's breathtaking, right? Really, to stand on the island so long and then see ships sailing your way.
Absolutely. So, how has your experience been with IFA so far?
So far, so good. There's been so many people I've met here, and from so many walks of life, and from the mental health side to yesterday when I saw a gentleman who produced a device that you can swallow, and then it'll record. It'll record take pictures of your inside your body while they're using what do you a controller device to make it move around your body and navigate, and it's just in the research stage. So you're seeing people like this that you wouldn't see otherwise. And a lot of times us innovators are so separated from each other that we don't. Once again, we don't have the interdependency that we need, and this kind of event makes that kind of thing happen. When you have like 300 people in the room that otherwise would never be in the same room with all these different innovations that could be useful for each other. So that has been the most, I would say, emotionally rewarding part of this. Yeah.
Absolutely. Well, we love having you here so much. Could you tell me where we can find your business details?
So the website is give.health. And we're making the app. We have about 10,000 subscribers. Currently, we're here. Obviously, we're looking for investment so we can have those 10,000 subscribers on the app. We currently don't have the financing for the bandwidth to make sure everything's safe and secure for everyone. Because it crashes without the amount of but we can make the web version available. It's found at http. You don't even have to say that. Sorry, I'm old school. bit.ly/givemhealth, which is give, GIVEM health. So if you just have a cell phone, you put bit.ly/givemhealth, you can then get the app. It's a symptom checker app where it has a symptoms calendar where you can place your symptoms just in case you don't want to. Let's say you're about to take the vaccine. You now can check your symptoms before you take the vaccine, see what happens to you after you take the vaccine. Let's say tomorrow will be the 26th, and then follow your symptoms along the way. In this stage where we don't have any idea about the long-term ramifications of the vaccine, we've figured that version of our product should be the one that we release right now. So that's available at bit.ly/givemhealth.
Perfect. Well, thank you so much for being here today.
Thank you very much for having me. It's an honor.